And to follow on with another OT perspective, this time I'll hand over to Claire Miller. Hi, Claire.
Hi, hiya. Hoping you can hear me okay.
Yeah, all loud and clear.
Thank you. So this is just a brief perspective, a different perspective to Debbie's. So just to introduce myself, I'm Claire Miller, an occupational therapist working in both local authority and independent practice. And throughout my career, I've worked with all ages of disabilities, sensory, physical, learning and behavioural needs, and provided adaptations within all of those sectors, including sensory needs for dementia as well. And a lot of what's talked about transfers over. It's really quite pertinent there as well. So in brief, this is a very, very brief session, and definitely signpost you to Debbie's course, the foundations course, and other training. We couldn't possibly cover even really get that nutshell in a presentation so short, but hopefully it'll give you a little bit of a taste of a different perspective. So we're going to think about what sits behind behaviours, why requests for adaptations might be declined, and just to summarise whether adaptation is the solution, and within that think about some of the bigger picture issues as well. So long list here, I'm not going to read these out, I'm not going to go through all of them, but this came from just a quick sort of round robin email to some of my professional peers, and this is what came up from just less than a handful of replies. That's what we are presented with as professionals, whether it's occupational therapists in housing teams, local authority teams, or direct to home improvement agencies and local authority services, is behaviours which are really compelling and have a significant impact on the child and the family within their home. But from a professional perspective, we seek to also explore what's going on behind those behaviours, because there's a potential to reduce, regulate, and potentially manage some of those behaviours through support from other appropriate services. And this in turn can lead to simpler solutions, pared back solutions, different solutions. So it's about not overlooking what sits behind those behaviours. And I know that these are covered in the report as well, but it's more than just trying to avoid doing a big adaptation. It's more about the quality of life of that individual child and their relationships and how they live their life and how they engage, not just in the home, but in the wider community as well, because we want children to get the most out of life. So simple examples of changes that can impact significantly on behaviours might be family routines, pain management, toilet training, safeguarding. Lots of things could be going on behind these behaviours that actually need to be addressed. And the outcome may still be adaptation, but the quality of life will significantly improve for the child. So the impact of behaviour can lead families to request solutions such as those you see in the list down the side of the page there. I won't go into detail because I know Debbie's covered quite a lot of those in her presentation, and I've really summarised them, and it's not an exhaustive list. So it could be things like safe spaces, padded rooms, extensions, locks, etc. And examples might be that risk of harming others and the need for their own room, meltdowns and the request for a safe space, aggression, request for a padded room, going places they shouldn't, or accessing spaces that they seemed that they shouldn't be accessing, to might be locking them in or locking them out of spaces. And the potential outcome could be more space, which is actually fantastic and a huge bonus when managing a child and supporting, say managing a child, that didn't come across how I wanted it to sound at all, but living as a family with a child who has complex and additional needs. And the potential outcome of not exploring what's sitting behind the behaviours is exclusion, non-transferable skills, or particularly non-transferable facilities. So having a home that's so safe that actually environments out there in the community become less accessible, less transferable. It could result in no change, and actually it could potentially increase behaviours. So it's around working between supporting what lies behind the behaviours, and creating an environment at home that works for all, and of course centrally works for the child and their family. So just briefly, I wanted to touch upon why adaptation referrals might be declined, and we could expand on this all day long. And I just wanted to touch on legislation and perhaps service remits and the need. Legislation, so this is the dry bit, isn't it? So I've just picked little bits, little nuggets from legislation, and just starting with the Children Act. I'm not going to go into any great depth. I've just really pulled out a few of the little thoughts that are pertinent to me in this role as somebody who will make referrals and recommendations for people with behavioural and challenging needs. So under the Children's Act, the needs of the child are paramount. And the Act sits in place to enable children to thrive, to be educated, to reach their potential, whatever that may be. The legislation covers all children and acts to safeguard all children. So whilst we focus on the child with the complex needs, we're also taking into account all the children in the home and how this situation is impacting on them as well and their ability to thrive. And all children with disabilities are considered by a local authority to be children in need. So they have a focus, there is a responsibility there to them. And under the Act, the local authority has a wider duty than under adult legislation. So when acting as the welfare authority, all of those points, amongst others, are being explored by the OT, the social worker, and others involved. This legislation also sets out parental responsibility as well, which has to be balanced with safeguarding the interests of the child. Just thinking about the Children Act as well, I was just kind of listening to Kirsty talking earlier as well. We need to remember that piece of legislation wants us to work together in the best interests of the child. And it doesn't actually stipulate only if you're employed by a statutory authority. It's about the best interest of the child. So that can include drawing information that's relevant from other professionals or the people in the lives of that child. So just moving on, we've got the Human Rights Act there. I'm not going to work through all of those articles, but really important, and it does come up quite a bit there, is the right to family life. So that reasoning why we might use under Disabled Facilities Grant, we might use spaces differently for children as to adults to allow a child to be able to sit around the table, to learn to engage in family life, to eat meals together, to do homework with parents. And that's quite different to perhaps how we might utilise space in adult adaptations. But equally, this might be an adult with complex needs who also needs space to dine, to be within the family, to maintain social contacts and social routines. So it's always very much, family life, it's needs led, isn't it? Also, we think about the Mental Capacity Act, which is in place, as Debbie said, for children over 16. But this provides us with a best practice approach in relation to taking a least restrictive approach to acting in the best interests of all. And I do think it's an important and powerful piece of legislation. So, least restrictive really sort of flies out to me. And this is not really about deprivation of liberties. This is about opportunity to enjoy life, enjoy a world, to grow and develop and progress through life as the child or the young person is able to. So it's about opportunity. And lastly, the Royal College of Occupational Therapists advocates that OT intervention takes a whole person approach to both mental and physical health and well-being, enabling individuals to achieve their full potential. So we might be thinking about service remit. And I had a lot of blurb and facts and figures on here, but in a nutshell, it's usually the local authority OT that is approached when it comes to children's adaptations, not exclusively. So some authorities, DFG funding authorities will accept independent referrals. I've done many myself actually for children and young people. But it's often the local authority OT because of the capture of the Children Act. There are also CCGs and NHS trusts involved in supporting children. 223 NHS trusts, 106 106 clinical commissioning groups. I didn't get the facts and figures on the district and borough councils delivering DFG services, and often it's a different authority that might be providing the local authority OT assessment. So there's a lot of room for working together and integrated services with a broad capture, but equally there is room for a lot of gaps. And there is that potential that for strong partnership working, but equally I've seen myself across the UK, there are opportunities that are missed where services become siloed and separate. And that's where we can experience some of what both Debbie and Kirsty spoke about, where there can be gaps in between around responsibility, around communication, around information sharing. I could talk a lot about that for a long time, but I don't really want to focus too much on that. I think what's really key is considering, identifying, knowing what the gaps are, looking at demands and waiting times and looking at how that can be managed, having a can-do approach to that rather than a can't-do. And there may be opportunity there for the use of things like the regulatory reform orders, etc., that enable those gaps to be managed more effectively. But Paul knows an awful lot more about all that, certainly, than I do. And I think, for me, it's about working together. However, whichever sort of tier of this we're sitting within, it's knowing what information is needed in order to meet the needs of the child and ensuring that that information is known to families and that it's clearly communicated. So service remits need to be shared. They need to be out there on the front page, not sort of tucked deep within websites and policies and in potentially somebody's drawer. And again, thinking of Kirsty's experience there earlier, if you knew what it was that you needed to know at the beginning, potentially that journey could be shortened, certainly an awful lot less stressful. So when you're thinking about identifying the need, I'm going to whiz right through because I could talk to you about it forever. Key is thinking about who is the need and what lies behind the behaviour, and we've touched upon that. And when I'm saying that, it's not disregarding the family's needs over the child's needs, but sometimes it may be possible to change things about what's going on that has a massive impact on the child, and that could be a small change, as we say, with a big impact. Thinking about supporting the child, the family, strategies, reviewing those strategies. A 5-year-old isn't going to be the same as a 10-year-old or a 15-year-old. When we're thinking about puberty and private time, it's such a difficult concept for many young people to deal with, but when you have other things going on as well, then that can present itself in some really challenging behaviours. And again, I'll move on from that a little because Kirsty covered an awful lot of the points I was going to make in her real life story. So supporting the child is really important, and evidencing the adaptation. And this is the bit that gets to be a bit of a sticking point, but actually hearing the child's voice. There's a reason for it. Local authority OTs exploring assessments of others because they are looking for a professional perspective of the child's voice that will tell us what that child's strengths are and how we might support those strengths through adaptation rather than containing them, separating them, moving them away and potentially losing an opportunity to support them. So again, sorry, we're going to look at the bigger picture and then the solution. Again, quite a list, and I could talk forever about it. I'm passionate about it. I think important things on this slide are the team around the child, focusing in on who's already doing things for this child. If we listen to them, those people who know that child, so the parents, the grandparents, the siblings, the child, of course, themselves, and those who are already supporting them in different environments, we can capture the key needs of the child and address that through adaptation rather than focusing on the end behaviour and containing that. I think what's really important as well is ensuring that families and all professionals around families understand in the simplest of way what the services are. What is a disabled facilities grant? What can it do for the child? What are the limits and how far can that be stretched? How can we ask for support? How can we complain? What is the ombudsman all about? How can we challenge the services that are around? Who are foundations and how can we access them for help and support? And managing expectations falls under that as well. So as I say, we're looking at the child's voice from those all around them. We're focusing in on whether the solution is necessary and appropriate to support the disabled need. And sometimes there are other things going on that when they are managed, there actually isn't an adaptation required, or something very simple and straightforward and far quicker can be accessed. Is the need for the support and the safety of the child, or is it for something or someone else? Is there something else going on here? And again, is there a team there supporting the family to ensure that we do the right thing and we don't exacerbate the problem? And is it providing access to facilities, or actually is it excluding the child from facilities and learning how to live in a household and engage with the family? Will the solution create positive change? And this links in with the next point, is it least restrictive for the child? Does it create opportunity to grow, develop and learn? And is it in the child's best interest? So my last slide was just an example of a success. Obviously names, etc. has been changed there. And what this aims to show, and I'm sure the slides will be shared out later, is that by working together simultaneously rather than over a long period of time, the family was supported, the child was supported, sibling relationships were supported, the need was unpicked, there'd been a change. What was that change? What was going on for Bindi? And underlying the behaviours in this particular case was an exacerbation of behaviours likely related to puberty and the need for private time, understanding herself and engaging with the male members of the family. So through a multi-professional approach, the outcome was a room of her own. And that was what was requested in the beginning, but there was much, much more than that provided. And that to me spells success, is working together in the best interest of the child and the family. So thank you very much for listening. A bit whistle stop, but thank you for your time.
Thank you, Claire. I think you've got a bit of a fan club growing in the chat box. So
great.
Really enjoyed listening to Claire. Her comments are really pertinent. I agree, she's brilliant. So I'll leave you to catch up with your fans in the chat box.